ProChoice.com's abortion facts stated that almost half of all pregnancies are unintended. Out of those half, 1.3 million each year end in abortion. ProChoice also stated that women between the ages of 15 and 19 equal 19% of all abortions. Women between the ages of 20 to 24 equal 33%, and women ages 30 and over equal 25%. Now this means that older teens and young adults have the highest abortion rates overall. Today, I will persuade you to choose a pro-life alternative to abortion. Milestones of Early Life stated that a baby's heart begins beating as early as 21 days after conception. Now, a day later than that, both the eyes and the ears begin to form. Now, what kind of pro-life alternatives are there to abortion? Well, first, you could choose adoption. There are two types. The first type is an open adoption, where the adoptive parents often have contact with the birth parents and the adopted child. Now, you could also choose a closed adoption, which means that everything is kept confidential and the record of the birth parents is kept sealed. Now, wouldn't you rather be able to say, I gave up my baby because I loved him, rather than saying, I selfishly ended my baby's life? You could also choose to keep the baby. BirthMotherResources.com explained that there are many organizations in the state that can help you care for your child, such as Medicaid, which is a state medical insurance for the state of Florida, or WIC, which helps with groceries and food for your baby. Now, if you're going to keep your baby, it's very important that you have a strong support system that includes both your family and your friends. AbortionFacts.com explains the negative effects from having an abortion. Now, physical effects of this could include death, infection, uterine perforation, and blood clots. Mental results of an abortion include post-abortion syndrome, which means you could have reoccurring dreams, you could have sleepless nights, you could have guilt and suicidal ideations because of this. AbortionFacts.com also reveals that it is very important to be fully educated on the procedures of how an abortion actually works. Now, during the first week, if you do choose to do this, you could choose for micro-abortion, which means that you would use a contraceptive drug to eliminate your baby. During the first trimester, Abortion Facts explains that there's a procedure called suction aspiration. The procedure for this includes first paralyzing the womb opening and then stretching it to open. Then a hollow plastic tube would be inserted into the uterus that has a knife-like edge on the tip of it. Now, this suction that's used actually tears the baby's body into pieces. The doctor would then cut deeply into the placenta and remove it, and the rest of the baby's body is then sucked out into a tube. Now, just to give you an idea, the suction of this is 29 times more powerful than your household vacuum. Abortion Facts reveals that during the second trimester, there's a new intracardiac injection that could be used for multiple births around 4 months. This would be used if you're having twins or triplets and you've come to the conclusion that one of the babies is handicapped, or you've decided that you don't want to have twins or triplets, you'd rather have 1 or 2 babies. The procedure for this includes using a needle that's packed full of poison that is inserted into the heart of the fetal baby. This is used to reduce the number of babies that you'll have during the delivery and to kill the handicapped baby if it is actually identified. During the third trimester, the abortion that could be selected is the partial birth abortion. This is called brain suction. I'd like to show you a visual aid so you have an idea of how this procedure actually works. You can see here, based on the picture, that around the age of 5 months, the entire baby is delivered except the head. Scissors are then jammed into the base of the skull, and a tube is inserted into the brain, and it is sucked out. The now dead baby infant is pulled out. I'd like to quote F. Boham, a doctor of obstetrics at Vanderbilt University Medical Center. There are no medical circumstances in which a partial birth abortion is the only safe alternative. There are plenty of other alternatives for this. I hope you can now understand the dangers of aborting your child that would affect both you and your baby. I hope that you would realize that the pro-life alternative is much more beneficial to your life. I'd like to close by quoting Nancy Rudolph Piercy. Abortion ignores the cause and treats the symptom. Instead of suggesting a way out, it offers a way out of motherhood.